Hello, how are you? Good. I'm good, thank you. I'm Nicola, one of the neurologists here at the clinic. I'll be carrying out your neurological assessment today. Now, I've gone through your report from your GP and they think you have MS, is that right? Multiple sclerosis. Okay. Now, I'm going to get straight into the exam, ask you questions along the way, and if you can tell me anything as well that you feel is relevant, that would be really good. Alright, so I'm going to get you to do a few things first, alright? This is going to be a mix of your cranial nerves and obviously specific neurological exam. Okay, so I'll be checking everything today. Okay, so can I just get your name? Thank you. And your date of birth. And when did your symptoms start? Okay. I have read through your symptoms, but I will discuss them with you a little bit later. Alright, so we'll start at the other end and work through. Okay, so if you could move your head down to your chest for me. And can you go right the way back? In discomfort. Okay, and that way. And that way. Can you rotate your head in a full circle? And the other way. So you do definitely have some discomfort and restriction when you do those movements. Okay. Okay. Now, can you do finger to nose? Okay. Finger, nose. Finger, nose. Lovely. Finger, nose. Okay. Now, if you could pop your finger out, and can you touch your finger and your nose? Okay, and the other side. Thank you. Okay. Now, if you could touch your heel and your shin. And the other side. Okay, now with your feet, I want you to touch heel and then the other shin and then the other way. That's it. Heel, touch your shin with the heel, that's it. Down. Okay, the other side. Heel and shin. Okay, so you're struggling with that. Okay. Okay, now I want you to do this quite quickly. Alright, I want you to wave and stick up your thumb, 2 fingers. Okay, so I'm going to do it quick. I want you to do as I say. Okay, wave, fist, thumb, 2 fingers, and rotate in a circle. And the other way. Okay, can we do the other one? Okay, and fist, 2 fingers, thumb, rotate, and wave. So you found it easier if I was slower. Okay. Which is your right hand? Which is your left? Thank you. Can you touch your head? Can you touch your belly? Knees? Ankles? Shoulders? Nose? Thank you. You're doing really well, okay, my lovely. Right. So, if you could stand up for me, my lovely. Alright. So, we're going to do the Romberg test now. Alright. So, if you can stand there for me, feet together. And close your eyes. Okay, you can open. Now, if you wouldn't mind just walking as you would normally to the wall for me. Okay. Okay, just stop there for me. Okay. Now, I want you to walk heel to toe in a straight line to me. Alright. Okay, careful. Alright, stop. Okay. Now, can you walk backwards? Now, could you walk back? And I want you to do heel to toe. All right. Are you okay? All right. Okay, that's fine. All right, that's fine. Okay. Yeah. All right. Don't do any more, my lovely. Okay, struggling with that. All right. Now, would you mind closing your eyes and walking in a straight line towards the wall? Now, don't worry, as you can see, there's nothing around you. All right, and I'm here if you need any help. Okay, when you're ready. Okay, stop. Okay, so you're definitely very wibbly all over the shop when you're doing that. Okay, now if you wouldn't mind just walking backwards, and when you're ready, and stop. Perfect. Come and sit down, my lovely. How was that? Bit difficult. All right, so you definitely not got a great balance and coordination. Right, if I can get you to just stand again for me. Now, can you stand on one leg? All right, okay, that's fine. And can you do the other one? Okay, stop. Okay, take a seat. It's all right. It's okay. You're doing really well. Okay, lovely. So all that is done, that's done. Okay, right, what is today's date? Okay, and where are you now? Are you sure? Okay, lovely. Now, I'm going to give you 3 words. Okay, and I want you to repeat them. Apple, penny, table. Apple, penny, table. Okay. Can you count backwards from 10 to 1? And what were the 3 words? Okay. Apple, penny, table. All right. Okay, do you know what the time is? Okay. And what's the month? Okay. Right, now what I would like you to do is pop your arms out at the same time and just leave them there. Okay, now out in front of you. Okay, relax. Now if you could just pop out your hands so I can just see them. Okay, you can relax. How does that make you feel? Do you feel like tired from that? Is it hard work keeping them still? Yeah. Okay. All right, my lovely. You're doing really well, okay? All right, so that is that section complete. So I'm going to do your reflexes. Okay. All right, okay. If you can just flop your arms for me. All right, I'm going to go in there. This one. Okay, on the other side. Okay, all right. Okay, so I'm going to do your knee. Hang it there. Now the ankle. Okay, if you could pop your foot like that for me. Okay, I'm just scratching the sole of your foot. Okay, and this side. And your ankle. And turn your foot up. Okay, lovely. Hands. Just going to scratch across them. Okay, lovely. Yeah, not so much. But, you know. Okay, so that is that. Lovely. Right. I'm now going to get my light. Okay, I want you to look at my nose. Now the light will be bright, okay? I'm just having a look in your eyes, okay? Keep looking straight ahead. Look up. Down. Back at me. To your right. To your left. And back at me. Now I want you to follow the light, okay? Okay, and again. And follow it. Thank you. Okay, look at my nose. Look at the light. Nose. Light. Nose. Light. Nose. Light. Nose. Light. Nose. Light. Nose. Okay, thank you very much. Okay. Can you raise your brows? Frown. Smile. Puff out your cheeks. Can you suck them in? Can you pout? Okay, relax. Can you do me a big smile and show me your teeth? Good. Okay. Right, can you pop out your tongue for me? Okay, can you wiggle it? Can you curl? Can you touch the roof of your mouth with it? Can you pop it in your cheek? And the other one. Okay, relax. Can you open your mouth? Can you say ah? Can you try and wiggle your tongue and say ah at the same time? Thank you. Okay, that's that one. Okay, I'm going to get my light. If you can open your mouth. Can you say ah? Okay. Can you try to swallow? Okay, now I want you to just swallow as you would normally, okay? That's it, swallow. Okay, I'm going to touch here, okay? Swallow. And again. Okay, lovely. Now can you chew for me? Okay, open your mouth. Close it. Open. Close, okay. And can you close your eyes? Open them. Close them. Can you open and blink, blink? Blink, blink. Blink, blink, blink. And what about a wink? And wink. Wink. Blink, blink. Wink. Blink, blink, blink. Wink. Struggled a bit there, but well done for trying. Okay, I'm going to put my hands on your shoulders. Okay. Now I'm going to push down. I want you to try and push me off, okay? Okay, now can you shrug? And again. Okay, now can you try to do that for me? Okay, other way. Good. Perfect, relax. Now can you hold my hands? Okay. Now I want you to squeeze, release, squeeze, and release. Okay, lovely. All right. Now, if you can hold my hand, that's it, flat like that. Now, I want you to push against my hand. Okay, and again. And I'm going to push you back whilst you're pushing me, okay? Try to resist. Okay, all right. Other hand. Okay. That's it, push against me again. Okay. Now I'm going to push back, okay? Okay, relax. Would you say you feel weaker than normal? Okay. How are you feeling after doing all this? Are you feeling quite drained, quite fatigued? Yeah, okay. You will be tired when you go home, my lovely, okay? Yeah, it's been a long day. Okay, so I'm going to touch your shoulders. Okay, now I want you to turn your head to the left. And back, now to the right. Okay, thank you. Now, can you pop your arms out for me? And out to the side. Above your head. And what about behind your back? All right. Okay, that's fine. You feeling okay? Good. Okay, let's let you have a little rest for a moment and let's have a look at these. Are you up to date with your dentists and opticians? Okay. Right, I'm going to show you a couple of these images. Okay. Okay. I want you to tell me what it is, okay? What's that? And what do you do with it? And what's this? And what do you do with it? Okay. And what's that? And what do you do with it? Okay. So what are they? What are all those that I showed you? They are, yes. Okay. Okay. What's that? What is it? And what sound do they make? What's that? And what sound does it make? I always have to do that one because I find it funny. Okay. What's that? And what sound do they make? And what were they? Good. Okay. What's that? And what's that? Okay. And what's that? And what are they? Okay. Right, let's just do this one. Okay. What's that? Mm-hmm. Mm-hmm. This one. And what's that? And what are they? Good. Well done, my love. Okay, that's good, that's fine. Right. I want you to cover one ear and I want you to repeat. Cucumber. Cucumber. Chocolate. Chocolate. Okay, and cover the other one. Pineapple. Pineapple. Staple. Staple. Okay. Now, cover both. I want you to see if you can hear me. Relax. Relax. Steep. Steep. Okay, and you can remove them. Now I'm going to whisper things in your ear and I would like you to repeat them. Coconut. Coconut. Beautiful. Beautiful. Sleepy. Sleepy. Tick-tock. Tick-tock. Okay. Roses. Roses. Gloves. Gloves. Purple. Purple. Popcorn. Popcorn. Okay, now I'm going to turn around and I want you to repeat what I say. Sausage. Sausage. Banana. Banana. Brush. Brush. Okay. Now I'm going to pop my fingers either side and I would like you to tell me which side you can hear. Okay. Okay, good. Now I'm going to one side and I'm going to move it. I want you to tell me when you can't hear anymore, okay? So you can hear that. Okay, and I'm going to bring it back. Tell me when you can hear it. Okay, same again. And back. Okay. Have you ever had a hearing test before, a full in-depth one? Okay. Any hearing issues in the family? Okay. Do you wear glasses normally? Okay. Oh, lovely. Okay. Okay, so I'm going to get this now. Look at my nose. I'm going to cover one eye. Okay, I'm going to cover your eye now. And can you see that? That. Okay, and the other side. Lovely, well done. Now, got a couple of things here that I would like to use. I want you to close your eyes for me. Alright. And I want you to tell me if you can feel when I touch. So you could feel all that. Good. I want you to tell me how it feels, okay? Okay, soft, yeah. Okay, does it feel hard or? Okay, so soft but firm. Okay, if you have a look, that is what I was touching your face with. Okay, close your eyes for me. Okay, I want you to tell me when I touch. Lovely. Now, how does it feel? Yeah, correct. Open your eyes, and this was it. Okay, lovely. Close your eyes for me. Okay. Now, this may feel a little bit sharp. Yep. Okay, open your eyes. So this was the device, and did it feel sharp to you? All right, did it feel warm or cold? Okay, lovely. Close your eyes. Okay. What does it feel like? Lovely, open your eyes. Okay. Alright, so okay, lovely. Okay. Right, I want you to close your eyes for me. Okay. Keep your eyes closed. Okay. If you can tell me when I touch your face. Okay, now how does it feel? Does it feel cold or warm? Okay. Great. Does it feel cold or warm? Okay, you can open your eyes. Okay, now close your eyes. Keep your eyes closed. I want you to tell me if I'm moving my finger up or down. Okay? Okay. Okay. I'm going to bring my finger close to your face. Seeing how your eye reacts. Can you tell me when you can start to feel my finger? Again. Okay, thank you very much. Right, can you close your eyes for me and clench your jaw? Okay, you can open. Okay, lovely. Okay. Close your eyes. You feel that? Mm-hmm. Lovely. What about this? How does that feel? Mm-hmm. Okay, lovely. So that was this device. Okay. So can you feel the difference between hard and soft? Okay. And hot and cold. All right. Okay, so that's that done. Okay, a couple of little moving things now. So, I want to relax your arms. Right, okay. So, can I have your hands and arms, if you just put them out for me, just relax as you would. Okay, now I want you to tell me if you could feel these, okay? How does that feel? Okay. Okay. Mm-hmm. Okay, and same the other side, okay? Mm-hmm. Okay. Can you feel the difference? Describe it. Okay, wonderful. Don't look at the objects. Same on your legs. Okay. Mm-hmm. Can you feel the difference? Okay, and the other one. Okay. Can you feel the difference? Good. Now, can I have your hands and close your eyes? Okay. Can you feel that? What's it feel like? Yeah. What about this? Mm-hmm. Okay, what about this? And this. Okay, and other one? Mm-hmm. Yep. Okay. Could you feel all the difference? Lovely. Okay. So this one was the spiky one, this was the really soft fluffy one, and that was the soft firm one. Okay, and the little scratching was the end of this. Okay. Well done. Well done, my love. Right, I'm just going to work through my checklist to make sure I've done everything I need. Let's do that still. Okay, on that one side. Okay. Okay, so that one's done as well. Okay, right, if I can have your foot. Okay. You feel that? How about this? I'm sorry, I know, a little bit ticklish. Feel the difference? Lovely. And the other one. I know, sorry. Lovely, and feel like that. Lovely, you can relax. Right, so look at my nose. I want you to tell me if you can see. Let me move my fingers, so tell me which side you can see. Wiggle. Keep looking at my nose. I'm going to move position. Same again. And move again. Keep looking at my nose. And same again. Keep looking at my nose. And really close. Lovely. Same again, but instead of wiggling my fingers, I'm going to put a different amount up. I want you to tell me what I put up. Okay, lovely. Now I will recommend that you go and see an optician and have a full eye examination. Alright, I think that is something that's necessary. I only do obviously basic checks. I will need you to have a full examination, okay, so everything, check with the machines and air and everything that they do. I obviously don't do that. I can do obviously the basic checks that I've done today, but I would like you to go to the opticians sooner rather than later. All right, yeah, if you wouldn't mind, please, that would be really good. Now I know my chart's very far away, but can you read anything? If so, read as far as you can. Okay, what colour's that? And that. Okay. Yeah, so if you could get them to do you a colour blindness check as well, that would be really good. Lens check and all the machines that they do. I can definitely do that for you. I can actually write you that, that's fine. Yeah, so I will email you that. Okay, so then you can give it them. So make sure they do the full works, all right? And then I will need a copy of that, all right? If they won't send it me, if you can request it and then pass it on to me, that would be really great. Okay. Now, obviously, you can go to your dentist whenever you like, lovely. I don't need to know the result of that unless it's any issues with your jaw. Then it will be nice for me to know. But by the tests that I've done, I think your jaw's perfectly fine. All right. You're welcome. Okay. Okay. So, right. I want you to tell me if you can feel this, okay? How does that feel? Okay, so you can feel the vibrations. Okay, give me your wrist. Other one. Okay. Okay, and just on your leg, okay. Okay, now can you hear this? Okay, lovely. Right, last couple of things, my love. I have 3 solutions. Okay, you've got some water there. If you could just rinse your mouth for me. Yeah, just in the bowl next to it, my love. Right, now I'm going to drop something on your tongue, okay? I want you to tell me if it's sweet, sour, bitter or salty, okay? Please rinse your mouth during each one. Thank you. Bless you. Yep. And last one. Perfect. Right, so now I'm going to get you to sniff 3 things, okay? And I want you to tell me what it is. It is coffee. Gorgeous. Okay, ready? Yes, oranges. Last one. Yes, mint. Right, that is that. Okay, so I've done everything, okay, but I just need to ask you a couple of questions. Have you experienced any episodes of blurred or double vision? Okay, any tingling in your arms, wrists, hands, legs, feet? Feet, you know what I mean? Okay, so do you feel like you are clumsy? Do you fall over a lot? Do you bump into things? Okay. Do you find yourself quite tired, lethargic? Okay. Any headaches or nausea? Any pain anywhere? Ever feel like you've got the flu but you haven't? Okay. Any bouts of insomnia or sleeping too much? Any medication? And what's that for? Okay. You take any supplements? Okay. And can you tell me what kind of things you eat in your diet? Okay. And what do you drink? Okay, that's fine. Do you smoke or vape? And do you drink alcohol or take drugs? Okay, lovely. Now, do you exercise at all? What happens if you do? All right. Okay. Right, so everything I've done today, my findings, the report that your GP sent over to me, which was very detailed with all your symptoms, I do think you may have MS, my lovely. All right. Yeah, I thought you might. But I want to send you for a scan, if that's okay. So I want an MRI scan, a full one, head to your base, your spine. All right, so we'll be doing that. Yeah, that does sound like restless legs, my love, and it's not very pleasant at all. I suffer with that myself. I get it in my arms, down my back to my middle back and down my legs. Do you do that too? Yeah, it is quite common in restless legs. It's not just to be in your legs. Yeah, it's not very nice. Okay. All right, so I'm going to send you for an MRI scan, and I need a full bloods doing, okay? I've got a range of different bloods. I want to see if you're lacking anything, see if everything's working. It's going to be a lot more advanced than you would have anywhere else, okay? So there will be a few bottles. The nurse will be doing that for you today, and hopefully you'll get in with the MRI today as well. You're quite efficient, and then I can see you back and have a discussion on everything. Alright, so we'll get you in for the scan, get your bloods done, then I'll get you back and we can find out what's happened. Alright. You're very welcome. There's no particular cure. No, I mean we can help sort of manage things and make things a little bit better for you. So don't worry about that. I will do up a full plan for you, treatment plan, to make sure that everything's working all right. Okay, you're not going to be left alone, my lovely. I'm here to support you and help you. All right, got a fantastic team here. All right, and give you some groups and different things like that as well. But I just want to do the scan first, just to see, and obviously the blood test, put everything together before I make a final diagnosis. All right. You're very welcome. Do you have any questions? Okay, well if you do think of any, please just contact me. All right. Now I'll let you go and wait in reception, and I can get the nurse to come and get your bloods, do some vitals, and then hopefully the radiographer will be ready to take you to have your scan. All right. And then I'll get you back. Okay. Yeah, the nurse will sort out a follow-up. Okay. It was lovely to meet you, and I'm sorry to hear that you're struggling. But you're not alone. All right, it's okay. All right. You take care now. Bye-bye.